Welcome. So the theme for this month is immune system, and last month is detoxification. And because of my schedule and due to some technical issues, I wasn't able to jump on live last month. So today I'm actually going to be combining it. So the topic is we're going to be talking about intravenous, that's IV, so intravenous therapy and your immune system. Excellent, thank you. I appreciate all of you kind of responding, letting me know that you can hear me. Thank you. Okay, so for IV therapy, we're going to talk about three things today. What is IV therapy? And why are all these athletes recently, or these celebrities, or why even at Brio, why are we getting so many calls about IV therapy? So I'm going to explain what IV therapy is, and then I'm going to answer a question. Can IV therapy really increase my energy, or can it help boost my immune system? And I'm also going to cover a question. The question is, how does IV therapy help with detoxification? So for those who don't know me, welcome. My name is Dr. Jeffrey Lee, and I'm a naturopathic physician and as well as a registered acupuncturist. And I am the co-owner of Brio Integrative Health Center in Richmond, British Columbia. And I've been in practice for over about 15 years. Now, I really missed chatting with all of you and doing the Facebook Live because I've been quite busy putting together my first online course. And it's a course on stress resilience. And I'm already on, I think, week 7 in my 8-week course. And for any of you interested in learning more about that, I have actually a free masterclass, and you can go to ultimatestressreduction.com, and that's ultimatestressreduction.com, and you can watch an hour masterclass of me just coaching you along on how to reduce the stress. So and then from that masterclass, I'm actually teaching an 8-week course all about building up that stress resilience. So that's what I've been working on. Now, I want to start by just sharing with you a story of a patient of mine. And this patient has been a patient with me for years. I worked with him with his diabetes and heart disease. I helped him lose a lot of weight there. And so this was probably about 5 or 6 years ago. He came back to see me again, and this time he was covered in hives. He had these red, itchy bumps all over his body. And it got so bad that he had to go to the ER. So he was in the emergency room, I think twice. He saw his medical doctor a few times, and they weren't sure what was going on. They gave him some oral steroids to take. They gave him a bunch of different ointments, but nothing helped him. So I did my workup, and in my assessment, one thing that I did pick up was he had switched to a new blood pressure medication not too long ago, and also this was about 5-6 years ago, where there was some strange viruses that were happening. So nothing to do with what we're going through right now with the COVID-19, but a few years back there was a lot of people had these interesting viruses, these cold viruses, where they would get sick for a period of time, they would recover, feel great, but a week or two later they get sick with the exact same symptoms. So that was going on, and he was experiencing that as well. And some people in his work were getting these strange illnesses. So what I actually ended up starting on him was I started putting him on a herbal therapy as well as some supplements to try to calm some of that inflammation or that itchiness on his skin. But it was actually around that time where I had started to bring IV therapy into my practice. That I actually ended up putting him on a few doses of IV therapy. Now, this is a good time for me to segue a little bit, because I've been in practice for 15 years, and the first 7 or 8 years of my practice, and Dr. Nitu and I decided that we didn't want to bring IV therapy into our practice. We really wanted to build a practice that taught people how to modify their lifestyle. We really wanted to get to the root cause and really help people build up their understanding of nutrition. But it was around that time where we started attracting just very, very complex cases. And a lot of our patients were just really either immune compromised or they had a lot of gut issues where they had difficulty absorbing a lot of nutrients there. So that's when we decided to bring in IV therapy into our practice. And this patient just kind of perfect timing. I ended up putting him on 4 treatments of IV therapy, and it made a significant difference for him. Actually, his hives completely cleared. It was gone after those 4 treatments there. And I'm going to explain why I think what happened there. But the key thing that's really happened is I think he was missing a lot of really important nutrients to especially detoxify his body. So that's, I just wanted to start by giving you that story and then lead into what exactly is IV therapy and how does it work. So IV therapy is the delivery of vitamins, minerals, antioxidants directly into the bloodstream. So it's done very similar to what you see in hospitals, where you see an IV bag in a hospital where it's slowly dripping something right into the veins of patients. Now, the difference is in a hospital, it's they're usually dripping in hydrating fluids, but they're also putting a lot of medication in there. Now, we do something very similar at Brio where the IV setup doesn't look different. But instead of medications, this is where we're putting in nutrients in the body. And an example of nutrients that we use are things like vitamin C, all the different types of B vitamins, different minerals, magnesium, calcium, for example. Now, IV therapy is a very, very efficient way of getting nutrients, so vitamins and minerals, into the body, right? It just taps right into your bloodstream. And where we do IV therapy, it could be on veins in the hands or in the arms there. Whichever way, we use a very gentle butterfly needle that just, very easy. Usually it's not painful at all. Okay, so that's kind of like a quick overview. Now, how does IV therapy work? Now, when the body is sick, or when you're exhausted, or if the body's under a lot of inflammation, our cells, the cells in our body, they're not efficient anymore at absorbing nutrients. And so that's where the problem is. Now, how we generate energy or how we heal, we need to make sure all our cells are actually able to absorb nutrients. And actually, just 2 days ago when I was teaching my course, I was teaching a lot about mitochondria or energy in the body. And I was just explaining to people that our cells typically have 1,000 mitochondria, and mitochondria is these energy factories in our cells, and that's what produces energy for us. But key areas like our brain or in our eyes, those demand a ton of energy, and there's 15,000 mitochondria in each of those cells there. So our cells need nutrients to be able to generate the energy for our body to function, for different areas of our body to function there. So when we're sick, or when cells are damaged, or when they're inflamed, it no longer absorbs those kind of nutrients there. So what an IV therapy does, or an IV treatment is, by putting a higher concentration of vitamins and minerals, we get that higher concentration gradient into our bloodstream. And that higher concentration gradient drives more of those nutrients into the cells. And again, when we can get nutrients into the cells, that's when the cells can start functioning properly and generate energy. Now, a question that a lot of my patients ask me, well, how is this different from taking supplements, taking oral supplements there? So my answer to that is, under normal circumstances, under normal conditions, most people can get all the nutrients they need from foods and from their supplements. Now, however, when people are ill, or if you've developed a malabsorption where you're not digesting things well, this is a time where it's very difficult for our digestive system to properly absorb all the nutrients. And that's why you see in hospitals, it's such an efficient way of delivering, medications in hospitals. But again, this is a very efficient way of delivering nutrients in the body. So, um, yeah, the key thing there is IV therapy. It doesn't get blocked by kind of, or it doesn't get regulated by absorption. Like, I'll give you an example. There's a study that shows that um, if you eat like a 12-fold increase of vitamin C, you actually don't get all of that absorbed. You only get about 25% of that absorbed through your digestive system. So actually, the digestive system does act as a barrier, and I think that's actually a very good thing. It's a protective thing, right? So if you have like a whopping dose of whatever you're eating, that our digestive system acts as a barrier, and it limits how much you can absorb there. But in circumstances when you're ill, when you're sick, you do need to make sure you have those vitamins that get into your system. So I hope that answers the question about taking supplements there. Now, what are the benefits of IV therapy? So, although IV therapy is very trendy right now, and I know a lot of people, because of what's going on in our environment right now, everyone's really worried about the immune system. So we're getting a lot of calls about IV therapy. But I always want to remind whether it's a new patient or an existing patient, this is a medical procedure. So it does require a very thorough medical evaluation. And so at Brio, we really disagree with people being, just kind of dropping by or choosing from a menu of like, this is what I want, because it's actually very, very important that we do a proper screening process to make sure that this is safe for you. Because at the core of our philosophy, and for those of you who are familiar with my approach, the weeding phase and the seeding phase, like, I'm really looking for the root cause there. So for some of my patients where I start off with IV therapy, I use it to boost up their body, but usually I really transition them into doing the right lifestyle changes, eating the whole foods there. So I just wanted to mention that. So the benefits that I often see in my practice are increased energy. It does support the immune system. It helps with sleep. It eliminates things like headaches and migraines there. I've also been able to help a lot of patients with cognitive function, and my interest is in helping the brain optimize. So some of my patients with IV therapy have really benefited from that. And then most definitely, IV therapy is great for detoxification. And that's what I'd like to do, just to kind of wrap up today's Facebook Live, is how does it support with detoxification? And I just want to remind you, and I've shared this with in previous kind of Facebook Lives, our body has three main ways of detoxifying. It clears things out through our liver, through our kidneys, and through our lungs. And the backup system is through our skin. Okay, so the liver gets rid of volatile, like oils, those fats. It helps us get rid of fats, dumps it out through the bile, and we excrete it out. The kidney gets rid of like water-soluble toxins, and then the lungs gets rid of a lot of our volatile gases, right? We expel that through breathing there. Now, the key take-home message about detoxification is it takes an incredible amount of energy. So it's a very active process. So the body needs very important vitamins, very important minerals to be able to function properly. It needs those nutrients to clear those toxins out. For example, I've talked about how the liver detoxes, where there's phase 1 and phase 2. So if there's a toxin that's in the system, our body needs to, the liver, what it does is it through phase 1, it actually turns it into something that is a bit, more potentially damaging. It has to, transform it into we call it a more reactive species, or just a reactive molecule. And then it's through phase 2 where we neutralize that. And then those toxins get excreted. Every step, the phase 1, phase 2, and even the excretion, it requires a tremendous amount of energy. And to get that energy, you need to make sure that you have important nutrients there. So that's why it's very important. IV therapy can be a very important part of the whole detox process. Now, I want to now transition back to the patient story that I was sharing about earlier. When I was talking to him and he was talking to his medical doctor, we think that change or that transition in that new medication that he was taking likely triggered some kind of strange reaction in his body. And his body was kind of at a state where it was a little bit deficient around that time. He was under a lot of stress around that time, and his body wasn't able to have enough nutrients to clear things out. And I think that's why the IV therapy made such a big difference for him. Like in 4 sessions, he was able to, completely get rid of the rashes and the hives there. And the IV therapy just gave him that boost of energy because he really noticed that his energy was a lot better, his sleep was a lot better. And that vitamin C that he got in the IV therapy, it really helped stabilize the histamine in his body. And his histamine was getting quite out of balance, getting that having that itchiness all over his body. So I hope that makes sense on how how IV therapy can also help with detoxification. So let me just kind of wrap things up. In summary, IV therapy is a safe and a very efficient medical procedure, and it's a great way to get key nutrients into your body. The benefits of IV therapy include more energy, a stronger immune system. Often my patients have better sleep. I also use it for like injury recovery. And then thirdly, IV therapy, it gives the body the energy it needs to properly detoxify. So if IV therapy, sounds like it's right for you, please give us a call and we can schedule a proper assessment visit with you to see if it's the right fit for you and make sure it's safe for you. So I hope that was helpful. I just wanted to give you a good summary of how IV therapy can help with your immune system, but as well as tie it back with some detoxification. Now, are there any questions? I'm going to stick on for just a few more minutes and answer any questions that you might have or anything that I can make a little bit more clear. So I'm going to give you just a moment there. Well, I know sometimes there's a slight delay with getting the comments there, but this is excellent. I hope this was actually quite helpful for you. If you have any other questions later, just feel free to just write them in the comments there, or just email us. Again, I always enjoy just sharing some of these health tips with all of you. And hopefully I'll be able to get back into a good rhythm of every couple of weeks be able to jump on and share some more content with you. Have a wonderful day, and I look forward to seeing you soon. Bye-bye.